So this is me here with the nursery, or actually this is on the ward. So kind of the pediatric part was kind of three main things that we did. One is the ward, and actually Dr. Chuck Miller, who is there, he is a wonderful gentleman to get to know. He just kind of does all kinds of mission trips. He didn't really do any mission trips earlier on in his life. He was basically a general practitioner in the U.S., and after his wife passed away, he went through a lot of depression and ended up that he found missions, and he's really been involved with that, and he's been on many, many trips. He has, I don't know, 4 or 6 a year that he goes on. He's going on a cleft palate trip probably right now. So he just kind of was a great help. I was very excited to have him because the pediatric service was pretty busy between the three places that we had. We had the ward, which is where these nurses work here. Oh, and how old Chuck was 80, remember? 80 something. So yeah, so he had a lot of energy, and really I was excited to have him there for his experience and just his encouragement too. And then there's Margaret here, who's a nurse practitioner student, who is also a real blessing to get to know. But basically, he primarily worked on the wards, and he saw the kids there, except I covered on the weekend. I was on call. And then I would work mostly in the nursery and seeing the babies there. He worked with the residents. The residents did not go to the nursery part of things, so I worked pretty much by myself with the nurses there. And then the other part we did was the outpatient clinic, and we saw patients during the day. So most of my time was at the nursery. This is Rosalind here, who was the nurse who worked with me. And she did such a great job, and then she told me at the end of the week that actually this was her last week. She was finished. So then they got a new nurse, Saline. I did not get her picture, but she was great too. But I just figured out how things were working out, and it was nice to have someone who really knew what they were doing.
Are those twins in there?
Those are not twins. So basically they had 3 incubators in this room. These are premature babies. This one here was about 31 weeks, and this one was about somewhere 28 to 32 weeks. It was kind of not really determined very well. But both of them were basically getting NG2 feeds. They both had some CPAP initially, although their CPAP, which is what basically is a airway pressure to help them breathe, does not work very well because they don't have a good enough seal. So they're working on trying to get that. But the incubators they have 3 incubators in the room. The incubator here that you can almost see does not work at all. And then there was one that was on the other side of the room where we'd be sitting here, and it was basically way too hot. It was like 42 degrees Celsius, which is like 104, 105. So it was really warm. So so they tried to put a baby in there one day, and the baby obviously had high temperatures, so we decided that wasn't going to be an option. So thankfully we kept these. We had 3 babies in here at one point, but the other one was able to transition because they were just 36 weeks. So it was kind of quite a challenge to be able to manage babies in this setting. The other thing I want to mention is just the people who are there now too. I was covering for, there are 3 different pediatricians who are there. 2 work part-time and 1 works full-time. And they went on vacation to, actually I guess I can't move it, but they went on vacation while I was there. And these are the moms for the babies. They went on vacation while I was there. And they are trying to make many, many changes in the nursery, such as temperature regulation, getting a sheet for discharge for babies, because a lot of times they wouldn't even see the well babies in the past, but now they're trying to make sure all the well babies are seen, which is a really important thing, because I found several babies. There was one baby that had a heart murmur, one baby had jaundice, while I was there just in 3 weeks, that would have been well babies that no one would have necessarily looked at. So they're trying to make some changes there, but it's always hard to make changes in a culture that's used to doing things a certain way. But they were they had very good attitudes about it, the staff did, and so I was just trying to keep up with the changes they've made. They've only been there for about 6 months or so. This is a baby under Billy lights there, so they do have that. One time we ran into an issue, though, where we needed 3 Billy lights and only had 2. Thankfully, we were able to finally get one of the babies we finally got the lab back. It took a while for the lab to come back, and they were able to take that one off the Billy light. So that was a little bit. So there's resources are a big thing there. This is the 36-weeker that was born and did well and fine there. That mom was pretty sick. The mom had HIV and TB and was just really sick. And actually, I think Dan kind of maybe consulted on her a little bit, but just kind of she was on the women's ward, so I don't know if you even saw her, but she was pretty sick. But it was good to be able to tell her that her baby was doing well. So. They do have, yes. So they have medications they give them there. So yeah, they sure do. And they have a really good protocol for it. They have, basically it's kind of a set protocol. They have a team there that deals with TB and HIV, and they kind of consult and they just kind of start the meds and just make sure people follow up and everything. It's really a good clinic there. This is the ward. Again, I didn't do much on that, although I did go to afternoon round just to kind of see what was going on. And they had a lot of femur fractures was a big thing there. They had some kids obviously with infection. We had unfortunately a lot of kids that died of sepsis. There were several just like couple days to couple weeks old that came in with sepsis. I think we had 4 or 5 of them that died, and so with cord infections. So as Dan mentioned, there was definitely good and there was difficult things too there. Yep, and there's Dr. Chuck. Oh, that's me. That's me there. I don't recognize the top of my head. I recognize that there. Yeah. So this is a baby that had duodenal atresia. So basically, the intestine there was a blockage where things did not form properly, and this baby came in very, very dehydrated. Had not eaten anything for several days because the baby was just vomiting. And this was one of the babies that had jaundice that did better. But the exciting thing is they have a surgery training program there too. And so we got the baby rehydrated. It took a couple days. And of course the labs, it was hard to tell where our sodium, potassium, all those things were at. But it was just a blessing to see that, that this is something they could fix there. And this baby ultimately went home. And it was just exciting to see that the good work that the surgeons are doing there as well too. So something that they can fix, and so that was great. Yeah, and this is a baby another surgery baby here that had on the ward that had cleft palate, cleft lip, cleft palate, and they were able to repair the baby's cleft lip, and will eventually have the palate surgery repaired too. And that was done by a surgeon who's a national doctor there from Cameroon, and he was able to do that. And so it was exciting. The baby also has tetralogy of Fallot as well too. So. And so there's kind of quite several anomalies there for the baby, but the baby did well. And this is the baby's great-grandmother, yeah, I only remember. So great-grandmother who has kind of taken care of this child. So, so she had a really great spirit too. So.